So there's a really famous Mitchell and Webb sketch you guys will have probably have seen, but if you haven't, it's basically like a government minister talking with his aides about how they can save money, and one of the options he keeps bringing up is if they should kill the poor, and how much that would help the economy in the long run. Now, we all know under capitalism, human life isn't really valued. Your life is only valued in terms of how much you can contribute in terms of labor, meaning most of the time it's about how much profit you can generate for other people. But we are now reaching the stage in late stage capitalism where instead of helping people who are impoverished due to no fault of their own, often in terms of like mental health or disability, people in countries with legal euthanasia are now recommending that these people actually just die. Like, join the medically assisted dying program so you can no longer be a burden on society. Now, before we get any further, I think it's important to clarify this isn't a video like spreading misinformation about Canada's assisted dying laws. More so that there have been various stories recently that are exposing the flaws in that system and also exposing what is often driving people to look at this program. And oftentimes, a lot of it is to do with their economic situation because that is so dystopian. And I saw that tweet going viral and it was about someone talking to their therapist and they're like, there's only so many things you can recommend to me that I can use to make my mental health better when we live in a capitalist system, because there's so many circumstances in terms of the economy outside of my control. This advice just isn't working anymore. And I feel like that is very relevant for this story because now Canada has expanded their medically assisted dying program to include people who aren't on like the biological course to maybe dying in the near future or have a terminal illness. It's now people who also have severe mental health. And I mean, in a vacuum, people might just say, well, individual rights, you get to decide what you do. If you can no longer handle being on this planet, then you have every right to leave in dignity. But then the problem being, like I said, a lot of these cases you read about people doing this because all the bad things in their life in terms of either physical or mental health is being exacerbated by their dire economic situation, which we could at least attempt to help with if we wanted to as a society, because that is too expensive. And neoliberal capitalist ideology does not value human life unless you are contributing to a labor pool which they can profit off. So all of that coming up for you today. Please like the video, and in the comments, I don't really have a question for today, but I will say feel free to share your thoughts on this stuff. Feel free to share maybe like your own experiences if you're Canadian, if you have any stories about the program in relation to maybe people you know. There's actually a really good video I watched today by We're in Hell, who is Canadian, talking about this stuff, interviewing people involved in this stuff and experts. Obviously a far better video than what this is. This video is more just like exploring like the ethical considerations and exploring how these sorts of laws could be used in the future as we increasingly decide that old people, the mentally ill, and the physically disabled are no longer worth anything to society. So also check out my social media at the Kavernacle on Twitter, on Instagram. Instagram is where I'm posting about my travels around Asia. And if you care about that even more, check out the Patreon page. I'm posting exclusive content about my travels. One video up at the moment, hopefully the one about Cambodia out soon. Also, other benefits include getting access to the private patrons Discord server and getting access to my Nintendo Switch friend code. Also, check out the subreddit and check out my second channel down in the description. So in this video, we're going to tackle euthanasia from various different angles, but I just want to talk about it in regards to myself and like my view on this stuff before we start talking about like all the political issues. Generally, in terms of euthanasia, I only first heard about it being like a thing you could have done to you in like hospitals and stuff when I was about like 14 in religion class, where we would debate like the ethics of euthanasia. Of course, it's not actually legal in the UK. Of course, you always heard about people going to like Sweden to have it done. And generally, I guess when we were thinking about that, it was with people with more economic means, because you actually had to physically travel to another country, pay for a private clinic. So the euthanasia debate isn't really something massive in the UK. It is there, but it's not like other countries, because I guess we have a more backwards view in terms of like the right to die with dignity. And me even phrasing it like that, of course, I do generally support individuals choosing when they want to die. In theory, I do support this. There are loads of cases where people have really struggled to be allowed to do this legally in certain countries, including the UK, which does force them to go to places like Sweden. So it should be made easier for certain cases. And I'm not saying the Canadian one doesn't have safeguards, but then we're going to get into how people view it once it's legal and how the capitalist class view it once it's legal. As someone who's had 2 family members die in the last year and a half, one from terminal illness, and my granddad who was suffering from Parkinson's, various different cancers, COVID and stuff like that. By the end of his life, he pretty much wasn't there anymore. And I also know people in my extended family who've been like my granddad, but they've been like that for decades at this point. So I obviously do understand the circumstances around letting people die with dignity, because you can just reach a point where you're basically not there in a bed 24/7, basically waiting to die. And the problem with talking about euthanasia a lot of the times is because the religious right hijack it so much. So a lot of the times, if you just type in Canada medically assisted dying, euthanasia, most of it is coverage by the right-wing press. And when they say stuff like it's culling the poor or the disabled, they don't actually care about that either. They're just using that as ammo because they come at it from a religious angle where they care about life in terms of a religious view of life, where they don't want people to kill themselves because that goes against the Bible and they end up in hell or purgatory. Just the same way they view abortion as murder, but when a kid is born, they don't care. And when a disabled person or a poor person is suffering, they don't want to make their lives easier. So I want to focus on the right to die for the elderly, because for a lot of people, it seems like a more clear-cut case. As your body deteriorates seriously and maybe your mental faculties deteriorate and maybe you just end up not being very mobile, and you can understand someone wanting to die before they get even worse. But there was a film that came out this year called Plan 75, and it's a Japanese film. And of course, Japan is a country with a rapidly aging population, right? But this dystopian film is interesting because there's actually a lot of parallels with some of the stories we're going to talk about today. So just reading parts of a review to explain this film to us. So a diet of rice and tofu, plenty of regular gentle exercise and excellent hospitals, the Japanese have nailed the formula for getting old prolifically. With a little less than 30% of the population over 65, Japanese society is now officially termed as super-aged. Meanwhile, thanks to a low birth rate and an ingrained opposition to immigration, the total number of people is falling dramatically. Each year, there are fewer young people to look after more older ones. It's a slow burn economic crisis. Of course, there's an obvious solution, unthinkable in real life, but very much in working order in Plan 75, which screened at Cannes. The plan of the title is a hypothetical government-funded program that merely offers seniors the chance to be bumped off quietly. It is never acknowledged to be a mass extermination program. On the contrary, it is entirely benevolent. There are little nudges along the way, it's true. Those who volunteer may receive a cash gift for a final fling holiday, a free funeral, even the chance to die in a 5-star spa resort. Muzak-filled infomercials playing in every hospital waiting room gently remind potential clients that nobody wants to become a burden and that the Japanese have a proud history of self-sacrifice for the greater good. Michi, one of the characters, is 78 and still works as a hotel cleaner. All her colleagues are similarly elderly. When one collapses on the job, however, they are all retired. Coincidentally, Michi discovers that her apartment block is about to be demolished. She has no income and nowhere to live, so keep this Michi character in mind as we talk about real life things. A man behind the desk suggests that she could go on welfare, but her expression of dismay tells us that this is seen as akin to sleeping on a park bench. Better death than humiliation. So Japan is a good case study, but this is going to affect multiple countries. As general health gets better, most countries are going to have aging populations, and if you don't have a high birth rate, you're not going to be able to replace those people in the economy. And of course, they're going to need more doctors and more medical professionals to look after aging people who have more diseases and more illnesses and stuff like that. Everyone can understand that. But in the capitalist mindset, there isn't a real desire to be well, how do we solve this, right? How do we make people have more children? How do we incentivize that? How do we look after the elderly better? There's no real thought that the money spent to preserve life in this regard, help the elderly live comfortably or make people's economic situations better so they can have more children if they want to. Neoliberal capitalism is more in line with this Plan 75 thing, thinking, well, old people, you cannot contribute labor anymore, you're a burden, it would be better if you die, because as you've gotten older, you're just costing us so much money and you're not contributing to society. Of course, they always ignore that, you know, old people have paid their taxes for decades and decades to contribute to this very society the younger generation are now living in. But to the capitalist class, again, life really has no worth if you are not contributing to a global economy. And the elderly are a good example of this. So although that Plan 75 seems really dystopian, I don't think it's too far off from reality. That's of course what makes good dystopia. But also that character we talked about, Mishi, talking about like the economic situation as an elderly person. So now I want to talk about a video that was going viral on Twitter of someone in Canada who is basically choosing to die. They are seriously ill, but what is exacerbating this illness is their economic situation, which is pushing them to have medically assisted death because it's too painful to live in their current circumstances. So to a compassionate person, you would be like, let's help this person, no matter the cost. But to capitalists, it's basically like, well, that's a you problem that you're so poor, so I don't know, die if you want because you'll be less of a leech on the system. So let's have a look at the video.
Imagine choosing death over homelessness. That's what one St. Catharines man is contemplating. Tonight on City News, we continue to delve into medically assisted dying and how some believe it is their only option to living in poverty.
Are you afraid to die?
Who isn't? Yeah,
Amir Farsood has applied for medically assisted dying, known as MAiD. He lives in constant agony due to a back injury, but has started the process for end of life because his rooming house is up for sale and he can't find anywhere else to live that he can afford. He barely survives on Ontario disability support payments, which are just over $1,200 a month. He doesn't want to die, but being homeless is not an option.
I know in my present health condition I wouldn't survive it anyway.
Farsood meets the criteria for MAiD: physical suffering due to disability that cannot be relieved. His doctor, who knows Farsood's real reason for MAiD is his fear of being homeless, signed off on the application in August. Farsood needs a second to do the same. There's a 90-day waiting period. He believes he could potentially access MAiD in about a month.
I don't wish to be dead, even with the pain, even with the meds. I still want to be here.
So I don't know what the situation now is for Amir. Hopefully after this has gone pretty viral, he is getting some sort of economic help, because isn't that so dystopian? He has a bad back, he doesn't want to be homeless, but he clearly wants to live. So even though one doctor signed off on this, he needs another one. That second doctor should not sign off on that, because it's clear this guy can live, this guy wants to live. Why would you euthanize this person unless it's all about saving money? It's saying he can't survive on the disability support. He's being kicked out of his apartment. It seems like this is all to do with his economic situation. So could we maybe, I don't know, cut some money somewhere else, like insane military budgets for places like Canada and the UK and America, and put it towards properly funding people with physical disabilities so they don't have to literally choose to die, because if they went homeless, it's pretty likely they couldn't even fend for themselves. So like he was saying, he might die anyway. I don't think inherently there are massive problems with this being legal for various different ailments, but what happens is then you have the individuals who make mistakes or have difference of opinion. There's already one doctor who signed off on this for him, right? And you're thinking, what is wrong with that doctor? But as we're going to see, there are other people who take this law and then start saying to people, well, instead of our organization or the government improving your material conditions to help you live a more comfortable life, why don't you just die instead? So on the subject of killing people to save money, here's a report I read while researching from 2017, before MAiD was like expanded for like mental health and stuff. So medically assisted deaths could save millions in healthcare spending report. New research suggests medically assisted dying could result in substantial savings across Canada's healthcare system. Doctor-assisted death could reduce annual healthcare spending across the country by between $34 million and $136 million according to a report published in the Canadian Medical Association Journal on Monday. The savings outweigh the estimated 1.5 to 14.8 million in direct costs associated with implementing medically assisted dying. The takeaway point is that there may be some upfront costs associated with offering medically assisted dying to Canadians, but there may also be a reduction in spending elsewhere in the system, and therefore offering medical assistance in dying to Canadians will not cost the healthcare system anything extra. The euthanasia could save Canada between $35 million and $136 million. Now, of course, this is like a widespread study. It's looking at various things, and it is probably looking at cases where you do have someone who's like in their 90s and has lots of different ailments, illnesses, and stuff like that. But of course, it's just quite dystopian to say, well, there's a massive strain on the Canadian healthcare system. Do you know what would make it better? If we made it way easier to let people kill themselves. And that report was in 2017. And then you have a story like the one we just watched from this year. And that's what I'm saying about the consequences of this stuff. While there might be like genuine intentions with the lawmakers who pass it, inevitably in a neoliberal capitalist system, people are going to start viewing human life in terms of monetary cost. So a guy like that who is like a burden on the system, taking like disability payments and stuff like that, there is no incentive to help him. It's quite literally better for capitalists for this guy to die. If you don't have anything to offer the free market, if you don't have anything to offer a capitalist society, then you'd pretty much be better off dead, to be honest. We can clearly see that there's so much like spending in terms of like the military and stuff where they could cut it to focus more on care for the elderly or helping the disabled. It's a choice that they make, but it's not a choice for us. You're being coerced to make a choice in a capitalist system. So this guy that we saw in the video, what is his choice, right? His choice is either dying with dignity in a medically assisted dying facility, right? Choosing how he wants to die, or being forced out onto the street and maybe dying in a more like horrible way, right? That's his choice. But how is that a choice? How is that a choice for anyone? Capitalism has robbed this guy of his choice because clearly, if it was up to him, he wouldn't die. So again, what is that choice? There isn't a choice there. So we've been speaking about age and economic circumstances. Now, Canada has recently expanded this medically assisted dying to include people who may not be on the path to like biologically dying in the near future from like a terminal illness or something like that. Now you can get it for having mental health issues as well. So if you go through the Canadian government's website, you can see outlined all the different criteria you have to meet to get MAiD and what the process will actually entail. In the We're in Hell video, he actually talks about how this has been kind of done in the past, and I found that really, really interesting. They give you every opportunity to opt out, even until like the very last moment. And there's obviously like loads of criteria and checks from like medical professionals, but like I was showing you earlier, there's always going to be flaws in the system, and just like that guy who was going to go homeless, someone signed off on that. And there's always going to be the human flaw in this, and it's never going to be applied exactly how you would want it to be applied. So from March 2023, you can be severely mentally ill and get this. And I'm sure there'll be case studies of like maybe younger people who will get this and you will understand. But of course, we're going to see stories where you think that person should have never been approved to get it because their problems, while severe, were exacerbated by their economic situation. And at the very least, you didn't try hard enough to improve their economic situation and their comfort before doing this. You took this drastic step way too early. I think this is the massive problem we're starting to see, and we're probably going to see even more. They don't try other methods before taking this drastic step. And that's the thing, because they don't think about the economic factor. They don't think about how, in terms of like mental health treatment and treating illnesses, a lot of the time it has to do with your access to care and your access to a comfortable environment and not worrying about money, not having to work a terrible job that in many ways will either exacerbate things like in terms of mental health or in terms of your physical health. So we've been talking about like cracks in the system and the human element, and regardless of what you think of the MAiD law, and if you really support it and you support everything in it right now, there's been numerous stories which have mainly been picked up by the right wing and religious press saying, look at what Canada wants to do. They don't care about life. They want to kill our veterans. They want to kill the mentally ill. They want to kill the disabled. Like, that's the purpose of the bill, not like a horrible side effect of it being implemented. They feel like Justin Trudeau and the Liberals, they've done this because this is what they want to do, because they're godless and they don't care about stuff. So I just want to read about a few cases to like highlight what I've been saying, that this human factor and the way it's been implemented, and of course neoliberal brainwashing, which makes people feel like you should even suggest this or sign off on it, is playing a massive role in the problems with medically assisted dying in Canada, which, like I said, are probably going to be exacerbated even more once you can receive this for being like mentally ill. So back in August, disturbing, experts troubled by Canada's euthanasia laws. So Alan Nichols had a history of depression and other medical issues, but none were life-threatening. When the 61-year-old Canadian was hospitalized in June 2019 over fears he might be suicidal, he asked his brother to bust him out as soon as possible. Within a month, Nichols submitted a request to be euthanized, and he was killed despite concerns raised by his family and a nurse practitioner. His application for euthanasia listed only one health condition as the reason for his request, and that was hearing loss. Nichols' family reported the case to the police and the health authorities, arguing that he lacked the capacity to understand the process and was not suffering unbearably among the requirements for euthanasia. They say he was not taking needed medication, wasn't using his cochlear implant that helped him hear, and that the hospital staffers improperly helped him request euthanasia. So Alan Nichols lost his hearing after a brain surgery at 12 and suffered a stroke in his recent years, but he lived mostly on his own. His brother saying he needed some help from us, but he was not so disabled that he qualified for euthanasia. In one of the assessments filled by a nurse practitioner before Nichols was killed, she noted his history of seizures, frailty, and a failure to thrive, whatever that means. She also wrote that Nichols had hearing and vision loss. The Nichols family were horrified that his death appeared to be approved based partly on Alan's hearing loss and other concerns about how Alan was euthanized. They lodged complaints with the British Columbia agency that regulates doctors, asking for criminal charges. They also wrote to Canada's Minister of Justice. The hospital says Alan Nichols made a valid request for euthanasia, and that in line with patient privacy, it was not obligated to inform relatives or include them in treatment discussions. And here's where it gets even worse. Some disabled Canadians have decided to be killed in the face of mounting bills. Before being euthanized in August 2019 at the age of 41, Sean Taggart struggled to get the 24-hour-a-day care he needed. The government provided Taggart, who had Lou Gehrig's disease, with 16 hours of daily care at his home in Powell River, British Columbia. He spent about $264 Canadian a day to pay coverage during the other 8 hours. Health authorities proposed that Taggart move to an institution, but he refused, saying he would be too far from his young son. He called the suggestion a death sentence in an interview with the Canadian Broadcasting Corporation. Before his death, he had raised more than $16,000 to buy specialized medical equipment he needed to live at home, but it still wasn't enough. So British Columbia doesn't provide a disability benefit income above the poverty line. In some regions, it is as low as $662 a month, less than half the amount the government provided to people unable to work during the pandemic. So other disabled people say that the easy availability of euthanasia has led to unsettling and sometimes frightening discussions. Roger Foley, who has a brain disorder and is hospitalized in Ontario, was so alarmed by staffers mentioning euthanasia that he began secretly recording some of their conversations. In one of these recordings, the hospital's director of ethics told Foley that for him to remain in the hospital, it would cost north of $1,500 a day. Foley replied that mentioning fees felt like coercion and asked what plan there was for his long-term care. "Roger, this is not my show," the ethicist responded. "My piece of this was to talk to you to see if you had an interest in assisted dying." Foley said he had never previously mentioned euthanasia. The hospital says there is no prohibition on staff raising the issue. Catherine Fraze, a professor at Toronto's Ryerson University, said cases like this were just the tip of the iceberg. She cited the case of Candice Lewis, a 25-year-old woman who had cerebral palsy. Lewis's mother, Sheila Elson, took her to an emergency room in Newfoundland 5 years ago. During her hospital stay, a doctor said Lewis was a candidate for euthanasia, and that if her mother chose not to pursue it, that would be selfish, Elson told the Canadian Broadcasting Corporation. And just one more story as we talk about the flaws in this system. This was a popular one going round on right-wing news. Paralympian claims Canada offered to euthanize her when she asked for a stair lift. And basically what happened was that a total of 4 such discussions have been confirmed to involve a single VAC service agent. So basically they were going around offering people who needed like stair lifts at their home euthanasia instead. But again, a lot of the articles are saying like Canada, the Canadian government, were doing this when it was one person in this institution. But there you have a few case studies of what I was saying. The individuals involved in this process, the doctors or people, organizations who are maybe brainwashed by neoliberal capitalism, where they're saying, well, 1,500 a day for treatment for someone with a disability, well, that's too much. Have you considered euthanasia instead? That is actually something that happened. And then you have, this other one about you'd be selfish not to consider euthanasia for your daughter. And then you had that guy recommending to people who need stair lifts that they should be killed instead. Not to mention, of course, that doctor who signed off on that guy wanting medically assisted dying instead of going homeless. And I think all of these together show you the flaws of euthanasia in a neoliberal capitalist system, because neoliberal capitalism isn't just like the economic model we have, it's also an ideology that infects so many people in the world. People literally cannot imagine a world that isn't capitalist, and they fully buy into this neoliberalism, this individualism, which pits us all against each other, where we start valuing human life in terms of like dollars and stuff. And also the underlying thing here is like massive widespread ableism as well, because the people involved in this, the doctors and other people, in these cases, they don't seem to care about disabled lives. That's why people have been making like Nazi comparisons, because Nazi Germany had an extreme form of this, where they would kill all people they viewed as parasites, undesirables, people who put a strain on the system, which included, of course, disabled people. And of course, in neoliberal capitalism, that's how a lot of people feel about disabled people anyway. Like, they cannot contribute to society. They're just leeches on the economy and stuff. They don't pay their fair share. They don't work to make someone insanely wealthy. They don't always have their labor value extracted for the benefit of the 1%. Therefore, they aren't worth anything to society. So when they go to hospital, I'll tell them that their hospital stay is costing the government $1,500 a day, because they're acting like it's coming right out of their own pocket, because fundamentally these people view disabled people in a similar light, that they are just drains on the economy. And again, that's what in my mind neoliberal brainwashing has done to people, where you don't value human life in the same way in terms of like who it is. And even if these MAiD laws have the best of intentions, like you just want to help people struggling and die with dignity, like I've showed you, in a neoliberal capitalist system, you're gonna have these people who are going to offer it to people who shouldn't be offered it, because you haven't tried to help them in other ways. So many of these stories are related to the cost of living that they're having, or the cost of treatment. These people should be helped, not killed, because they are seen as a burden on society. And as we see like late stage capitalism in all its glory for all of us, we now see what the capitalists want to do with this. And we've all known what they want to do for a long, long time. We've all known with that like Mitchell Webb sketch, killing the poor. They literally would kill the poor if they could. And stuff like this allows a lot of people to kind of facilitate that ideology, where they do kill undesirables they view as a drain on the system, because Canada could save $35 million a year if they just started euthanizing loads of people. So in general, I support medically assisted dying. And there's probably loads of cases you can tell me of people either in your own life or people generally who have benefited from this, have been able to die in dignity. They've been suffering for so long. And most of us have had this in our own lives. We've known relatives who are at the end of like terminal illnesses, and they're really suffering, and death is coming soon, but they're just going through absolute agony, and you wish you could alleviate their pain. Or you have elderly relatives who like slowly decline, and then of course some of them want to die at this point because they feel like, because of their physical and mental deterioration, they feel like it's time, and they want to die of dignity, not die in like a hospital bed where they're there like 24/7. Again, I totally understand that, but when you're expanding euthanasia to people with mental health problems from the age of only 18 plus, when you're expanding it to make it very easy to do, in a neoliberal capitalist system, where it seemed like in these cases where people have fallen through the system, where doctors are signing off on killing people who just have back problems and can't afford rent, like that guy in the video, or people who live alone but are having ear problems, or trying to guilt patients into actually choosing to die because they're costing the hospital money, it's clear we need to radically rethink our economic system, because not only does capitalist and the capitalist class not value human life unless it's making them profit, it's now brainwashed so many of us that we don't value human life unless they are contributing to a capitalist society, meaning unless they're working a job and pay significant tax or pay their way in a way that we feel is okay, we have allowed neoliberal capitalism to brainwash so many of us to view them as burdens on the system, to view them as people who have no value anymore, because now we solely view value from, I don't know, people doing jobs and paying taxes or making other people money. So anyway, let me know what you guys think down in the comments, and if you made it this far, thank you for watching.